Hey guys, it's me, Natasha Lynn, and I am here with you today. Our topic is alopecia. Yes, there are so many different types of alopecia, and the questions I get about alopecia are just pretty much like at a alarming rate because it happens so often, and people are just they just wonder like what's going on with them. So I'm going to give you some information I have for you today, and hopefully you'll get a better understanding of what you can do if you are suffering with alopecia, or if you know somebody who has this disease. And I feel like I'm going to be saying alopecia a lot today, so just bear with me, okay? I'm not trying to keep repeating myself, but just bear with me, okay? But alopecia, basically, just to sum it all up, alopecia is basically a hair loss, or when you notice that you have maybe like a spot or a patch that's missing, okay? Today I'm going to give you several different types of alopecia, okay? It's pretty vital that you know these several different types. So if you are experiencing any kind of hair loss, maybe you can put yourself in this category, or talk to your doctor, and maybe it might not be alopecia at all. Okay. So the first type we have alopecia is alopecia areata, and it's a popular kind of alopecia. It can be brought on by stress. It is sudden or sometimes unrecognizable. So that means it will pop up and you're not for sure, what's going on with your hair. It falls out in patches or spots, and the sizes usually range from 1/8 of an inch, which is about maybe the size of a eraser, a little bit smaller than about the size of the eraser head. And it goes usually up to about 4 inches in diameter. So that's about maybe about like that. Areas where the hair loss is usually lighter due to poor blood supply. And this also comes from immune system attacks, when the immune system attacks the follicles. And so when I say poor blood supply, that's usually when something is going on in the immune system. It also can be due to an iron deficiency. So I'm big on iron deficiency because I've had an iron deficiency. So definitely check and see if your iron is low, and just getting you an iron supplement could be something that can you'll see a total difference. Okay. So the next one we have is called alopecia totalis. Okay. And this one begins with a small round patch, and it progresses until the hair is completely gone. This is the advanced stage of alopecia areata, the alopecia I just told you about before. This is the advanced stage. And this is also an autoimmune disorder. And it actually says there is an unknown cause to why it happens. So it's just an advanced stage of the alopecia areata. The next one we have is alopecia universalis, and that is total body hair loss. Again, this is an autoimmune disorder, and depending on how much hair loss you have, that will determine if the hair is able to be regrown, or if it's going to be able to come back. But actually, if you have less than half of the hair loss, then you have an 80% chance of regrowing the hair. So that's some sunshine out of the gloom, okay? And then if you guys have any questions, go ahead and type them in, and if I have answers for you, I'll go ahead and give them to you. If not, I will look them up for you. I'm also going to put in a link. Oh, thank you, Alina. Thank you. I'm also going to put in a link for 15 signs to where you would know if you have iron deficiency, because again, that's a big thing for me, and it's something I see in my clients as well, iron deficiency can cause hair loss, alopecia as well, okay? Androgenetic alopecia, that is male pattern baldness. This occurs in both women and men, but it's called, another name for it is called male pattern baldness. In women, it usually starts after puberty and slowly progresses over a period of 15 to 30 years. So that's saying if you have the androgenetic alopecia, it will slowly over time just start to recede. You can have a receding hairline, or you can have the balding spots back here. Okay. The next one we have is called, let's see. Hey, Naomi. Hey, Miss K. Hey, Miss Joy. The next one we have is called diffuse alopecia. And this is, or another name for it is called alopecia areata incognito. Okay. It mostly affects young females. And again, I've seen this in my younger clients as well. You'll see round patches again. And of course, it's usually on the head, and it happens all of a sudden. This can also be caused on by stress or autoimmune disorder. And then there says causes are also unknown. So if you happen to see this is what this is called: diffuse alopecia or alopecia areata incognito. And my next one is actually called postpartum alopecia. Now, this is very popular. I'm sure you've either, if you haven't experienced it yourself, you've had a friend or somebody who had hair loss after having a baby. Okay, so it says during pregnancy, very little hair shedding takes place. So while you're pregnant, you're basically your body is building up for this baby. It's having all the nutrients, everything is collecting everything, and it's giving it to the baby. So you experience very little hair shedding. So that's when you see women, they're like, oh, my hair is thick and it's long, it's growing and everything. That's what's happening. Your body is actually building up all of this protein and all the nutrients to give to your baby. So people who experience postpartum, of course, this is after the baby, usually 3 to 9 months after delivery, there could be a sudden occurrence of shedding. It usually within a year after delivery, the hair will return to normal. So it's saying usually. Some people may not have that experience. Their hair might still be a little bit thin. But if you notice this right away, of course, any of these alopecia symptoms, make sure you go see your doctor or your nurse practitioner, whoever it is that is looking after you, to let them know of what's happening with your hair. So this is a spinoff from the postpartum alopecia. It's called telogen effluvium. Okay, and it's similar to alopecia, the postpartum alopecia, because it happens during surgery, childbirth, okay, or a serious illness. So this will be something that would be kind of traumatic on the body, and your body's going through a whole lot, and it's just kind of, hormones are off whack, a lot of things are thrown off. So it is a reversible condition where the hair falls out after a stressful experience. It says stress pushes a large amount of hairs into the resting phase, and in a few months, those hairs will come out. So that's just saying that when you're in stress, your body takes this like flight or fight syndrome. So it's just like, whoa, what's going on with my body? So it holds on to it, but it puts your hairs in a resting phase. So when your hair is in a resting phase, that's when they shed. So your hairs, they're kind of like, oh, we're done for a while. Okay. So that's called telogen effluvium. Okay. Next we have very popular amongst textured hair or tightly curled hair is traction alopecia. And this has actually gone pretty much at a rapid rate. I'm kind of seeing it slow down a little bit, but traction alopecia, for a moment, I was just getting nervous because I've seen a lot of people with this. And it's just what it sounds like. Traction alopecia is when the hair is pulled too tight. When you see those little tight bumps, when they're like pink or white, the little bumps that are around, when you get braids or, a sew-in or something. If it's too tight, then you can have traction alopecia. It says most common with young women and girls with tighter curls or textured hair. Balding can occur if the hair is pulled too tight. So if the hair follicle is pulled too tight and the follicle is it gives out, the hair is going to fall out of it. And so when it's red or white or pink, that's just saying that there's a lot of stress on it. And what can happen is that whole follicle will close up and close off because it's sealing up. It's just like it dies off basically. So just want to warn you of that. Thank you, Miss K. Let's see. That's when the hair is pulled out from the root. So again, that is called traction alopecia. So you want to just be careful with your daughter's hair or your hair, pulling it back into a ponytail, even if it's one. Having too tight rubber bands around your edges, too tight braids. That's where you want to be really, really careful. Okay. Let's see. And then the last one I have for you is called anagen effluvium. This is a abnormal rapid hair loss, and it also happens in a short period of time. This is due to cancer treatments, drug use, or exposures to toxic chemicals. So, hey Patrina. So if you have experienced some abnormal rapid hair loss, we'll just use our cancer patients for an example. If they're going through like a chemo treatment or, something where they're putting a lot of chemicals inside of their body, this is where they would have the anagen effluvium alopecia reaction. So that's when the hair, it falls out. You might go to the bathroom and it's falling out in clumps. So that's something that would be extreme. I'm going to answer your question in just a second, Reginald. But again, that's anagen effluvium, cancer treatment, drug use, or exposure to toxic chemicals. And so Reginald says, which one do I have? So he's saying which hair loss treatment do you have? I would actually say you would have the male pattern baldness. And that is a very, very popular alopecia to have. So the male pattern baldness, or what was the other name we have for androgenetic? Okay, androgenetic alopecia. And it's just very popular. It's just saying that it's something along your bloodline, almost like hereditary, hereditary thing that you would have. But let me say this, because I don't believe everything is hereditary, even though the doctors would say something different. But there are definitely some Rogaine. There are definitely things that you can use to slow it down. Okay, you can slow it down. There's different things you can do. If you wanted to do a transplant, you could do that. Different things like that. But I would definitely say if you're trying to slow down androgenetic alopecia, you would want to do it in the beginning stages. Okay, it's kind of hard to take it back after years. You've been going through it for years. So even with my women too, if you're experiencing any kind of a lot of shedding, go see your doctor or your dermatologist right away. It's also good to see a trichologist. That's the person who studies for the skin, the scalp, and hair loss, hair treatment things. They are wonderful for the treatment of alopecia, different scalp disorders and stuff like that. A trichologist, you see if you have a trichologist near you. That's a goal of mine. So I will be a trichologist soon. Promise you guys that. But if you guys have any more questions, please don't hesitate to type your questions below, or send me a message, and I'll make sure that I get back to you on these. A lot of times these alopecia, I don't want to call it a disease, but this alopecia issues are treatable. So catch them early enough. We want to make sure we can save that follicle. We want to make sure we can save that hair, and we can replace it. So when the hair falls out, usually it goes into a resting stage, and sometimes the resting stage can last 3 to 4 years. So don't think that there is no hope for you. So I just want to encourage you guys about that. And Miss K says, yes, then we will not have to go look for one. Right. Exactly. But yes, I'll be a trichologist soon, so you won't have to go look for one. But yeah, so yeah, catching it early on is best. We can, save yourself from a lot of distress and, heartache. Losing hair it can be very, very traumatic for people. So if you like this video, go ahead and like it and share it, and send it to your friends who might have alopecia or have questions about alopecia. And I will see you guys all next week. All right. Thank you for watching.